Welcome to NCLEX Map, where we dive deep into nursing mastery. Today, we're focusing on the second vital step in the ABC framework: breathing, the essence of life. Airway opens the path, but breathing is what truly moves us forward. Breathing isn't just about air in and out. It's a complex dance of lungs and diaphragm working together. When this balance falters, tissues suffer, and organs can fail, even with a clear airway. According to the American Heart Association, effective ventilation is key to sustaining life. As nurses, our mission is to catch insufficiencies before they lead to serious consequences. Start every assessment with keen observation. Count respirations for a full minute. Normal rates are 12 to 20 per minute. Anything below 8 or above 30 needs immediate attention. Watch for shallow, irregular, or labored breathing patterns. These signal distress. Look for signs like accessory muscle use, nasal flaring, and paradoxical chest movement. Listen closely for wheezes, crackles, or diminished breath sounds. Check oxygen saturation. Anything below 90%, even on oxygen, is concerning. Early signs of hypoxia include restlessness and confusion. Late signs can lead to cyanosis and decreased consciousness. Never wait for blue lips. Act when the mind starts to fog. Hypercapnia, or too much carbon dioxide, can cause drowsiness and shallow breathing. This is often seen in COPD or narcotic overdose. These patients may appear calm, but are in danger. Major causes of respiratory compromise include asthma, COPD, pneumonia, and more. Each condition is unique, but our focus remains on oxygen delivery and ventilation quality. Core interventions are simple yet life-saving. Raise the head of the bed to improve breathing. Apply prescribed oxygen using the right method: nasal cannula, mask, or non-rebreather. Ensure all connections are secure and the flow is adequate for the patient's needs. Encourage coughing and deep breathing. Use the incentive spirometer regularly. These actions help expand alveoli and improve gas exchange, a key concept for NCLEX. Administer bronchodilators or nebulized therapy as ordered, and monitor for side effects. Follow up with corticosteroids to reduce inflammation, and always rinse the mouth afterward. Teach the correct metered dose inhaler technique. Shake, exhale, seal lips, and inhale slowly. Wait a minute between puffs, and remember the order: bronchodilator first, then steroid. Monitor arterial blood gases closely. Low PaO2 or high PaCO2 indicates gas exchange failure. Collaborate with respiratory therapy for further support if needed. In a scenario with a drowsy COPD patient, raise the head of the bed and titrate oxygen carefully. Too much oxygen can suppress their drive to breathe. Balance is crucial. If an asthma patient suddenly becomes quiet, it's a sign of emergency. Act fast. Start high-flow oxygen and administer bronchodilators immediately. Evaluate your interventions. Did oxygen saturation improve? Has the respiratory rate stabilized? Breathing can change rapidly. For NCLEX reasoning, prioritize oxygenation over comfort or teaching. When you see signs like dyspnea or cyanosis, act first to improve oxygen delivery. Avoid common traps. Don't give pain meds before assessing respiratory rate. Don't ambulate a patient with severe dyspnea before stabilizing their breathing. Always reassess after interventions, within 15 to 30 minutes for stable clients. Trending improvement confirms effective ventilation. Declining values require escalation. Evidence shows that early oxygen support reduces mortality in critical conditions. Nurses are the first line of defense against respiratory failure. We play a vital role. Remember this rule: a clear airway is useless if the lungs can't breathe. Support ventilation. Sustain life. And never underestimate the power of a deep breath. If this lesson strengthened your clinical reasoning, share it with your nursing community. Like, subscribe, and stay connected to NCLEX Map, where understanding meets action.